As Americans continue to find the way forward in the wake of the COVID-19 pandemic, 3 Catholic doctors say Catholic social teaching may provide a path to unity in policy making related to stopping the virus. Joining me now on Skype from one of the articles is Dr. Thomas McGovern, a national board member of the Catholic Medical Association and host of EWTN's Dr. Doctor, the CMA official radio show. Dr. McGovern, thank you for joining us.
Thank you for having me.
And during this public health crisis, we've talked a lot about all the needs out there and need to balance medical concerns with personal concerns and also religious liberty, for example. How does the moral and social teaching of the Catholic Church give us a framework in order to do that?
The Church gives us the 4 pillars of Catholic social teaching. First, the dignity of the human person. And that's what libertarianism seems to take as the only principle. Then the common good, which means allowing every person the opportunity to flourish, not just the greatest good for the greatest number, which is utilitarianism's viewpoint. And then solidarity, we're all in this together. And finally, subsidiarity, allowing those closest to a problem to come up with solutions.
Now, without a vaccine, we as a society are reliant on what you referred to as non-pharmaceutical interventions to control the spread of the virus, such as social distancing, but these can be harmful effects as well, could they not?
There's a robust science now showing that social isolation, whether or not people feel lonely, leads to a 25% increased risk of death. On this Feast of St. Clare, I particularly remember my mother-in-law, Clara, who died on July 8th from forced isolation in the assisted living portion of a nursing home. No visitors allowed.
Wow.
Also, as unemployment goes up, suicides and drug overdose deaths go up. And as there was reduced medical care during late March, April, and May, there were an increased numbers of deaths due to heart attacks, strokes, and there are many other problems like reduced vaccinations.
Specifically, what would you like to see in terms of policies that incorporate Catholic social teachings going forward?
I'd like to see a dashboard that has more than just the number of cases, hospitalizations, and deaths due to COVID. I'd like a dashboard that looks at everything involved with human flourishing. Look at the whole person, not just the physical body, and find safe ways to do all those things that are important to human beings, and use the principle of subsidiarity to allow those closest to the problem to come up with the solutions.
Valuable information there. Dr. Thomas McGovern, National Board Member of the Catholic Medical Association and host of EWTN's Dr. Doctor, thank you for joining us.
You're welcome.